So as the team physician for Pleasant Valley High School, St. Ambrose University, and Davenport North High School, I'm there on Fridays or Saturdays on the sidelines, hoping and praying that an athlete doesn't get injured. But in the event that an athlete does get injured, I'm available to evaluate the athlete, hopefully diagnose the problem, and provide some insight or treatment. We see all kinds of different injuries. Some of the more common injuries would include ankle sprains, shoulder injuries, knee injuries. That's a common question is, when to use heat and when to use cold. The way that I think about it is that ice decreases blood flow to an injury. It is sort of the first line of defense to decrease the inflammation. And heat, it feels good. It feels good to get in a hot shower. It can help increase blood flow to the area that you're concentrating on. And many therapists and athletic trainers will use heat as a way to loosen tissues up because it increases the plasticity by providing increased blood flow. So I think it's a useful tool, particularly in rehabbing injury later on. RICE, it's an acronym we use in sports medicine all the time. It stands for rest, ice, compression, and elevation. All of those things are useful, particularly the ice and the compression. It's very important to elevate the extremity even days after the injury because we're upright beings and gravity will tend to worsen the inflammation, and that manifests itself as swelling in the ankle or the lower extremity. So the more you can elevate it, that's also a tool to help fight that inflammatory cascade. Talking about ice and compression, that RICE that we mentioned, one of the useful tools we have here at ORA is the Game Ready device. And it's a super beneficial tool, particularly for post-operative patients or athletes in the face of an acute injury, because it provides not only ice therapy, but also compressive therapy at the same time. The Game Ready device is particularly useful for our post-operative patients that have had shoulder surgery or knee surgery or hip surgery, and our feedback on it has been really positive. I think there's some evidence that ice therapy in general and the compressive therapy can improve outcomes, and it certainly anecdotally improves patient experience.